Hello and welcome. Thank you everyone for being with us today. It is my pleasure and honor to be with you. My name is Lizanne, and I'm a physical therapist. I have an interesting and unique specialty. I work with people who have pain or problems in the area of their pelvic floors. So my patients are a lot like you. If you're watching this right now, it was likely your doctor or nurse practitioner who gave you this DVD. You've probably been diagnosed with some kind of problem or disorder in the area of your pelvis. Some of you may have pain or burning around the lips or inside the vagina. Some of you may have a great deal of urgency to urinate all day long, this odd sensation of needing to urinate. Many of you, like my patients, may have constipation or pain with bowel movement. And many of you will have discomfort or an inability to have any kind of vaginal penetration, making intercourse challenging. It's scary to have these sorts of problems. But I am here to tell you that there are things you can do each day to decrease your pain and increase your function and even heal yourself. Here's the catch. There is no magic pill or medication that cures you. The one common thing about these problems is that often there are some very tight muscles in the pelvic floor that are creating these issues. And the sooner you are able to relax those muscles, the better your symptoms will be. I have lots to teach and not enough time to teach you everything, but I have chosen the things that I think help my patients the most. You will see that this DVD is divided into 3 parts. In the first part, we will teach you your anatomy, the anatomy of the pelvic floor. Learning how the bones, organs, and muscles of the pelvis relate will help you understand your symptoms better. Then we'll learn a simple exercise that will teach you to drop and relax the pelvic floor muscles. In the second part, you will learn a handful of positions or postures, simple positions to lie in each day to practice your relaxation skills. In the third and final part, we will teach you some easy stretches to do that will further serve to open up and lengthen tight areas of your pelvic floor. First, I would like you to meet a little buddy of mine. This is the ravishing Rhonda, and she will be making some guest appearances on this video. Can you see that she is not any ordinary puppet? She is in the shape of a vulva. Vulva is a term that we use to describe the lips of a woman's vagina. Look at Rhonda's gorgeous outer lips. They're in the red velvet. Her inner lips are in this pink and purple satin. The area here inside is her vagina. And look, that little button right there is her clitoris. That's the area of a woman's body that becomes sensitive during sexual intercourse. Some of you might have pain or discomfort in this area of your body, and we're going to try and help you with that. When Rhonda makes an appearance, it is because she has something very special to teach us. I call her teachings gems, like diamonds, because they're special pieces of information, tricks, to help you further care for and relax your pelvic floor. And Rhonda is the expert. She is a vulva after all. Now, I just have one more word, and that word is caution. Not every person's symptoms or pain is exactly the same. So while I have carefully chosen each stretch and each exercise so that they are safe and easy to do, if any of you have any problems or increase in pain, please stop, ensure that you're doing that exercise correctly, and if it still causes pain, report back to your doctor or your nurse practitioner. Okay? That's it. I am ready to get going. What we need to do now is set you up so that you can easily watch this video at home. There'll be a handful of things that you can gather from your home to ensure that you do these things correctly. You ready to go? So here's what we need for you to do. We need you to grab a few things from your home so that you can better watch this DVD. But first, let me introduce you to the lovely Veronica. Veronica will be our patient today, and she'll be demonstrating all of the exercises and poses. Thank you for being with us today.
My pleasure.
I look forward to working with you. You will need 3 regular pillows, so go grab them from your bedroom, okay? 2 bath towels, and fold them into squares. You'll need 1 washcloth, dry please. And we are going to be doing most of the activities on the floor. So we have an exercise mat. This is actually a yoga mat. Don't worry if you don't have one. I would suggest just grabbing a blanket, a spare blanket, and folding it in half so that you have something comfortable to lie on. If you are uncomfortable being on the floor, don't worry. Just do these on your bed. Just make sure you can see the screen and the monitor well. Okay? Finally, we have here a heating pad because you might want to use some heat on your pelvic floor when you're doing some of the resting poses. We also have an ice pack, and if you don't have an ice pack, a bag of frozen peas works beautifully. We will be discussing the benefits of ice or heat a little later on. You will also notice that Veronica is wearing some exercise clothes. You don't need anything fancy. An old pair of sweatpants, even a pair of pajamas is fine. Whatever you feel comfortable and can move around in. Finally, please keep your remote control handy. You will want to pause and rewind the video frequently to rewatch something. Okay? That's all you need. Let's get going. Are you ready?
Yes.
Okay. So, we are going to start with learning the anatomy of the pelvic floor. We will learn about the bones, the organs, and the muscles. I think it's the easiest to start with the bones. I will be working with Veronica, and I would like all of you at home to follow along. So please stand up while I begin talking about your bones. For beginners, I would like to just show you what the bones of the pelvic floor look like. We are going to be finding the 4 bony corners of the pelvic floor. Think of a room with 4 corners. Everything that happens in your pelvic floor is happening within those 4 corners. Check out these beautiful bones here. These are our hip bones or pelvic bones. Turn around, Veronica. Let me show you what it looks like from behind. In the back, you see that we have the pelvic bones from behind, and I think they look like butterflies. So sometimes I call our hip bones or pelvic bones the butterfly bones. And you can see here there's another big, broad, triangular bone here. That is our sacrum. And then at the tip is our tailbone, the bottom of our spine. So we will be finding the 4 bony corners of our pelvic floor. In the front, pubic bone. In the back, the tailbone. And on each side, the 2 sitting bones. Now let's find them on our own bodies. Veronica, would you please place your hands on your butterfly bones or hip bones so that the fingers are pointing in the front? And everyone at home, follow along. Slide both your hands down the front of your body until you reach that pubic bone in the front. It's low down and in the front. I am going to put a little sticker on you, Veronica, okay, so that everyone can see it. That's bony corner number 1. Turn around, please. Place your hands, Veronica, back on your hip bones or butterfly bones. This time, can you point your fingers around the back? Beautiful. With one of your hands, would you please slide it down the back of your body until you reach that wide bone that is the sacrum, and then use your middle finger in between the crease of your buttock. Don't be shy, you guys. Let's find it. Okay, I know you can find it. And that is bony corner number 2, Veronica. That is your tailbone. Good job. I'm going to put a sticker here. Guess what? Hands back on your butterfly bones.
Okay.
Okay? This time, place the fingers so they're pointing down the sides of your bodies towards the floor. Nope. Can I help you?
Mm-hmm.
This way.
Okay.
Okay? Good. Now, reach around with each hand towards your buttock cheeks and pull the flesh away from the sitting bones that live deep inside the butt. Some of us have more flesh than others to pull away. I know, but all of you can find them. They're in there. Do you feel them?
Mm-hmm.
Fantastic. I'm going to put a sticker on each one. There's 1. Thank you, my dear.
Mm-hmm.
And there's 2. So here are the bony corners that are in the back and sides of our pelvic floor. And if you turn around again, and this is our bony corner, the pubic bone, that is in the front. All the action happens inside these bony corners. So we have found our bones. Some of you may have pain or discomfort around one of these bones. Who hasn't fallen on their tailbone at some point during their life, right? So we'll talk a little bit more about how to manage that. But right now, we need to proceed with our anatomy lecture. So everyone needs to go grab a chair. A dining room chair or a kitchen chair is best. Something with a flat seat. Nothing squishy. Okay? Okay, my dear. You did great with the bones. Now, the rest of the anatomy lecture will be on our organs and muscles.
Okay.
So you just need to sit comfortably in your chair, and we'll get going on the next lecture.
You got it.
It's Rhonda. Oh my goodness. Rhonda. Okay, Rhonda. This must mean that you're here to tell us what the first gem of the day is. Oh, this is why I have a partner, because I just I can't remember everything. So the first gem of the day is all about posture. Pelvic floors love good sitting posture. Thank you, Rhonda. Now, let's go through some great tips for some great sitting posture. Okay. You just found your 4 bones standing. Mm-hmm. So let's find them now in the seated position.
Okay.
Can you start, please, by rocking your hips from left to right so that you can find your sitting bones? Good, and your feet are flat on the floor. And for those of you at home, you can keep your hands resting on your thighs, but for the sake of filming, we are keeping our hands out of the way. Now come to a balanced, even position in between the left and right bones. Do you feel evenly weighted on the left and right?
Yes.
Beautiful. Now, of course, what do you think we're going to do? We're going to find some balance between the front bone and the pubic bone and the tailbone. Okay? So you're going to have to tip your spine forward to find the pubic bone. Can everyone see how Veronica's back is arching? Now, tip backwards to find the tailbone. Does everyone know what this position is? This is our slump. Who doesn't slump sometimes, right? So pelvic floors do not like this position. Veronica, come back to the front. And they don't want to be overarched either. So can you find a position now between a slump and between an arch? a comfortable position. Yeah, so now you're positioned evenly between all the 4 bony corners, in between the 2 sitting bones and the pubic bone and the tailbone. Place your hands back on your lap and just relax. What I would encourage you all to do is, while I'm speaking for the next few minutes about your organs and muscles, is find a comfortable position like this. Again, because pelvic floors love balanced posture. Okay? So now that you're all sitting comfortably in balanced posture, I would like your attention to this chart on the wall. We are going to start talking about your organs. Please take a look at this diagram. You can see that I have drawn the figure of a lady. She is standing sideways. Let's orient you. Here's her belly button. So this is her front. And does everyone remember the bone in the front of the body? That's the pubic bone. Here is the back of our lady. Here's her rump. And here is her tailbone. We have 3 organs in our pelvic floor. Let's start in the front. The first organ in the front is called the bladder. This is the little pouch that stores our urine or pee. Our bladder has its very own tube and hole, and this we call the urethra. You might know it as the pee hole. So when we need to pee, the urine comes through the urethra and out of its very own exit hole. Some of you may have pain or problems with urination. Some of you may feel like you have an urge to pee all the time, and it's usually because of the muscles around the urethra. The second organ of the pelvic floor is the uterus. Everybody knows what the uterus is. The uterus is where, if you become pregnant, is where your baby grows. And when you birth your baby, it comes out of its own tunnel and exit hole, and this, of course, is our vagina. For those of you that have monthly periods, our blood comes from the uterus out the vagina. Many of you have pain with vaginal penetration, and it's almost always because of the tight muscles around the vagina. And we'll learn how to relax those in a moment. Our third organ of the pelvis is the rectum. The rectum is the organ that holds our stool or our poop. And of course, you know, it has its own exit hole too. It's the anus. Oftentimes, what I see is that when a person has problems in one part of the pelvic floor, say around the bladder or the vagina, the rectum and the anus often start to develop problems too. Many of my patients suffer from constipation, which is an inability to empty their rectum. So, again, the anus has its own set of muscles as well, and we'll be learning how to relax those muscles in addition to all the others. So, to review, 3 organs: bladder, uterus, rectum. 3 exit holes: urethra in the front, vagina in the middle, anus in the back. Okay, everybody, let's talk about the muscles. We're going to be talking a lot about the muscles later on too. I am not going to teach you all the names of all the muscles. It's just too confusing. Let me orient you, though, to this diagram. Our lady, who was standing up, holding the organs, has gotten tired. So, she's now lying down, and you can see that this would be the top of her. And does everyone remember that it's our pubic bone at the top, it's our tailbone at the bottom, and on each side are the sitting bones. You guys know this. I know you know it already. We have 3 groups of muscles. let's take a look at the first group. This is the outermost layer of muscle. Check this out. This group of muscle surrounds all of our holes. Here's our urethra, here's our vagina, here's our anus. So problems with this group of muscle will certainly affect any of these organs. It might feel like you have to pee too much if these muscles are tight. If these muscles are tight, it might hurt to have vaginal penetration. And if these muscles are tight, it might actually hurt to have a bowel movement. Okay? So you can see this triangle here and this little grouping of muscle here that looks like the figure 8. That's our outermost layer of muscle. Now check this out. Our middle group of muscle looks like this little knot. It almost looks like I'm about to tie my shoe, okay? So that's a little knot. These are circular muscles that go around our urethra. Remember, that's our pee hole. All of my patients who have that odd sense of urgency to pee all day long, frequency of urination, or pain with peeing, these muscles are to blame. Okay, we will learn how to relax those. Finally, our deepest group of muscles. Okay, I've represented them here in pink. And look at this. They attach to our pubic bone in the front, and they attach to our tailbone in the back. This is a large group. They're wide and deep. These muscles support us and stabilize our spine, but boy, if they are tight, all kinds of problems can occur. You can get pain and cramping in your tummy. You can get hip pain, buttock pain, back pain. You can have pain with urination. You can have pain with vaginal penetration. And if these muscles are tight down here in the back, you can have real problems emptying your bowels. These are the biggies, and we are going to teach you how to relax those muscles. Okay? So our muscles here in the pelvic floor have a lot of jobs. They support our spine and keep us in good posture. They keep our urine and our stool inside our bodies until we're ready to let everything out. They assist in sexual pleasure. Some of them attach onto the clitoris. And finally, they support our organs. So these guys are busy. Too much to do for such a small grouping of muscles. So it's no wonder why so many people have problems in this area. And I promise you, I mean it, when you learn how to control these muscles, many of your symptoms will improve. Let's find Veronica now, and I'm going to teach her how to do a pelvic drop. And you all are going to follow along. Veronica, are you ready to actually, finally, learn an actual exercise to relax your muscles?
Yes.
We have done a lot of talking, and I am very proud of all of you for sticking with this, okay? Now the fun part starts. Veronica, I want you all to follow along. What we're going to be doing is training those muscles to let go.
Okay.
Let's do a little demonstration with your shoulders,
Okay.
okay? So everyone at home, shrug your shoulders up with Veronica. Good. Now let them go. That's all we're going to be doing.
Okay.
Except with the pelvic floor, it's a little bit harder to see, okay? In fact, because your pelvic floor muscles are inside our bodies, and there's no real movement like with an arm muscle movement, I've developed a hand gesture for us to use so everyone at home can see what we're doing. Okay? Because we're not going to take your clothes off.
Okay.
All right. Now, hand gesture first, okay? Place your open fingers in front of your pubic bone. Gently close your fingers. Lift your fist up your body, no higher than your breasts. Open your hand and push down. That's it.
Okay.
Let's do it again.
You got it.
Open hand in front of your pubic bone. Gently make a fist. Lift your fist up no higher than your breastbone. Open your hand. Push down. Okay? You can think of it a little bit like an elevator. As you close your hand, that's the elevator doors closing. As you lift your fist, that's the elevator coming up your body, maybe to the 4th floor. And then as you open your hand and come down, it's the elevator going back down to the lobby.
Okay.
Okay? Now, we are going to coordinate this now with the muscles of your pelvic floor. Listen carefully. Listen carefully, everyone. Okay, open hand in front of the pubic bone. As you close your hand, all I want you to do is close your pee hole, close your anus, so you're just doing a gentle squeeze. As you lift your hand up, can you squeeze a little bit harder? Squeeze those muscles in the pelvic floor a little bit harder. Can you feel them squeeze? Good. Open your hand. This is the hard part now. You have to relax the muscles of the pelvic floor. Relax your urethra, your pee hole. Relax the anus. Let everything go. Let's do it again. Okay, good job. Could you feel it? Good. Open your hand in front of the pubic bone. As you close your fingers, squeeze gently the muscles like you're trying not to pee or pass gas. Lifting the elevator up, and feel those muscles lift up a little firmer. Open your hand, let the muscles go. Fantastic. Good. Could you feel everything drop?
Yes.
Wonderful. Okay. Not all of you are going to be able to feel the up and down very easily. Some of you who are very tight may have trouble sensing the relaxation. Please bear in mind, this pelvic drop is all about the down. It's all about the relaxation. Don't overdo the squeeze. It may make you tighter. The squeezing just helps you feel your muscles so that then you know how to let them go. Does that make sense, Veronica?
Yes.
Okay. So for those of you who are able to do this exercise and can feel the up and down pretty well, I recommend that you do this 2 to 3 times an hour so that you can pay attention to your muscles and continuously allow them, ask them to relax throughout the day. For those of you that are having a hard time feeling the up or the down, stick with this. Rewind this section again. Watch this again. Perhaps you try this lying down. Perhaps you'll do it after you've done some of the resting poses or stretches, and you'll have an easier time. But please remember, this exercise is called the pelvic drop. It is about the letting go. Okay? Now, we've made it, Veronica. We've made it through our first section of this DVD, and we are now ready to do some resting poses. We're on to section 2. All right. Good job, everyone. Congratulations, everybody. You have made it through part 1. Part 1 is the hardest part of this whole DVD. That anatomy lecture, I know it's tough, but you did a great job. We are now ready to teach you 4 different resting postures. These are positions or poses that you can do each day to practice your relaxation and practice the pelvic drop. Now, I know what you're all thinking. You're thinking, when do I have time to relax? I have work, I have school, I have children. I know. I'm busy too. This is what I tell my patients. At the end of your day, after you've come home from work and eaten and put the kids to bed, take 5 to 20 minutes, and instead of slumping on the sofa watching TV, go find a quiet place in your home to lie down in and perform one of these 4 positions. Opening up the restricted area of your pelvis is incredibly beneficial. I know it doesn't seem like much, but it really, really is. I hear this every day from my patients. So you'll figure out which of these 4 poses is the best for you. Okay? You can use an ice pack or a heating pad. We'll talk about that later. And practice the pelvic drop. I'm ready to find Veronica and get going, okay? So everybody, grab your blanket or your yoga mat and let's get to work. Veronica, we are going to start you off with the simplest of all the resting poses. I call it the sleeping pose.
Okay.
You ready?
Yes.
Okay, let me talk you through it. Everyone at home, please follow along. Oh, you need to grab some things, yes? So grab your mat if you haven't already. Grab some pillows, and we've got our towels handy as well. So whatever you feel you might need from that introductory part, go ahead and grab all those props, okay? Veronica, lie down for me on your back.
Okay.
There you go. And place your arms at a comfortable distance away from your body with the palms up. Good. Allow your legs to just relax. And yes, there you go. Can you ensure too that your shoulders are not shrugged up, but you want to sort of get them down and relaxed underneath you? Very nice. This is the full sleeping pose in its pure form. Your palms are up. Your head is resting on the floor without a pillow or a towel. Legs flat. You're allowing all the muscles to let go. This opens up the area of the chest. It opens up the inner arms. It opens the belly. It stretches the backs of the legs. In this pose, you would just rest comfortably. Now let's show them, Veronica, what we can do to make some positional changes. To begin with, very simply, place your palms down now. So that's one modification, okay? Very simple. Can you feel that there's less stretch now on your arms? Yeah. Place your hands now on your belly. Can you feel now that there's even less stretch on your arms? Okay. Now, can you place one of these towel rolls and put it under your head? There you go, good. And can you take one of the pillows and put it underneath your knees? There you go. Good. Very good. And place your arms wherever you feel comfortable. Good. All right. So what we've done now is we've just supported her knees. We've supported her head, and notice I've used a towel roll. I chose not to use a pillow because I want her to stay relatively flat. But please feel free to use a pillow if you'd like. You can also feel free to use 2 pillows under your knees if you feel that there's just too much strain on your back. Now, in this pose, you're going to practice dropping and relaxing the pelvic floor. Okay? And just breathe naturally. Fantastic. So that's the sleeping pose. I would recommend this for anybody. Any of you watching could safely do this pose, and you can stay in this pose for 5 minutes, 10 minutes, 20 minutes, or longer. Perfectly safe. Rhonda, how do you do this? You're crazy. You're the crazy vulva puppet. I love you. What now? Oh, you're brilliant. You're brilliant. So Rhonda is telling us that we haven't taught you yet how to belly breathe. Again, thank you, partner. I appreciate that help. Belly breathing is a really important piece of relaxing the pelvic floor, but more importantly, it actually serves to decrease your pain. Every single one of my patients learns this technique. So I'm going to give this to you now. Veronica, now I know you've had a couple of children. You birthed those babies vaginally, didn't you?
Yes.
So you probably learned how to belly breathe a little bit back when you were pregnant, yeah?
Yes.
Okay. So you're a great model for us. Place one hand on your tummy and place your other hand on your chest and just let them relax there. Your hands will be here to monitor the movement of your body. Once you're able to feel the movement well, you don't need to keep your hands there. Okay. So what's your wait, let me guess. Your favorite color?
Pink.
Of course it's pink. Okay. You are going to imagine that you have a pink balloon in your belly.
Okay.
You will breathe in through your nose. And for the purpose of this exercise, Veronica, I'd like you to breathe out through pursed lips, like you're blowing out a birthday candle that's over here.
Okay.
Yeah, okay? Gently, slowly and gently. Breathe in through your nose, and as you breathe in, imagine that you're trying to inflate the pink balloon in your belly. As you breathe in through your nose, feel the belly rise way up high towards the ceiling. And everyone who's watching this, watch Veronica's purple fingernails go up as she breathes in, and watch her hand go down as she exhales. Feel the balloon, the pink balloon expands as you breathe in. The pink balloon relaxes as you breathe out. Breathe in, belly rises. Breathe out, belly flattens. Now, continue breathing like this. Veronica, bring your awareness down to the area of your pelvic floor. Can you feel the movement inside your body in the pelvis as you breathe in and out? What you should feel is an expansion, a gentle push into the pelvis as you breathe in. And you will feel a letting go as you exhale. Breathe in, opening. Breathing out, relaxing. Notice that there is no movement in her chest right now. She's keeping the muscles of her ribs very quiet. Breathing up in the chest is a poor and inefficient way to breathe, and it makes your pain worse. Breathing in your belly, slowly and softly like this, literally engages the part of our nervous system that decreases pain. It's vital for pain control. I know that a lot of you think this is silly or not terribly important. I promise you, this is one of the most important things you're going to learn today, okay? So you need to practice the belly breathing during all of your poses. Got it? Ultimately, increase the length of your exhalation so that it's a little bit longer as the moments go by. Ultimately, you want to have your exhalation be twice as long as your in-breath. Takes a little time to work up to that. Veronica, this next pose is called the legs over chair pose.
Okay.
What we'll be doing is actually inverting or lifting up your pelvis. And I'll explain who this is good for once you're in that pose.
Okay.
For starters, grab one pillow. Fantastic. And you'll be lying down on your back.
Okay.
But I need you to position yourself so that your hips, your buttocks, are very close to the edge of the chair. Okay? So you're going to need to scoot down a little bit towards the chair. Okay? That pillow will ultimately be going underneath your butt.
Okay.
That's it. And I want the full length of your lower leg supported. For those of you at home, you can use this. You can use your chair, or you could do this over the edge of your bed if it's not too high. You could do this over the edge of your couch. Good. Now, can you place that pillow underneath your hips? Now, as you do this at home, watch how she's moving very carefully. She's using her legs to push with. She's using her shoulders to push with. Okay? That's it. Good. And scoot just a little bit closer to the chair. There you go. Good. Let your legs relax. Beautiful. That's fine. And it's fine for your knees to come apart. Your arms, again, just as in the pose before, your arms can be palm up or palm down, or if it's just, if you have a stretch, too much of a stretch up here, you can put them on your belly. Okay? That's perfectly fine. Great. This pose is one of my favorites for those patients who have pain in the vaginal lips, pain inside the opening of the vagina. For my patients who have organ prolapse, and what that means is if the organs, we went over all the organs, if any of your organs are falling out a little bit, if you've had a few children, this is a wonderful pose for you. Why? Because what we're doing is we're lifting up the pelvis. We're actually lifting it up so that so that everything inside the pelvis can drain. Okay? For those of you that feel hot, burning, swollen sorts of feelings in the vagina, in the vulva, this is your pose. We can further modify this pose, if you need to, by putting a towel roll under the head. But I don't want you using too much pillow under your head, otherwise you'll be in too much neck flexion and that might hurt a little bit. Okay, so I prefer if you can just keep nothing under your head. This is a great time, Veronica, to talk about ice and heat. All right? It's kind of confusing when to use what. Ice packs. This is an example of an ice pack, okay? They come in different sizes and shapes, but many of my patients actually prefer using a package of frozen peas. Let it thaw out just a little, but look at that. It becomes very moldable. So you can actually position it right on the area of the pelvic floor. For those patients, for those of you who have a burny, hot, swollen labia or lips, for those of you that have sharp shooting pain that recently came on, say you did something you overdid something, that would be the time to use ice. Use it for 5 to 15 minutes, and again, you're placing the ice pack right over the lips of the vagina. Okay? I would, if it's very, very cold, I'd put it inside a pillowcase first. Heat, and this is an example of a heating pad. Okay? You can see it has a little control panel here. For those patients, for those of you watching, who have long-standing discomfort, achiness in the belly, a feeling of tension or tightness around the vagina, achy hips, achy back, use heat. And I place the heating pad right over the lower abdomen, just like this. Again, 5 to 20 minutes with heat, perfectly fine. Okay? All right. If you have any doubt about ice or heat, talk to your healthcare provider. They went to medical school. They're smart. They can help you with this. Okay? They can help you figure it out. Now, one other thing that's lovely, for those of you at home, Veronica, do you have any relaxation CDs at home? Do you? Mm-hmm. Fantastic. So relaxation CDs, pain CDs, CDs where there's somebody talking to you about relaxing, breathing, the sound of the ocean, sound of the waves, sound of the birds, all lovely. Throw that on your record player, your CD player, and listen to some nice relaxing tapes while you're in these positions. And look what, I think Rhonda left this the last time. Close your eyes. There you go. Ah, lovely. You can even place a little eye mask over your eyes to further relax. Remember, you're in this pose, you're breathing in your belly, you're relaxing the pelvic floor, and you could even practice the pelvic drop while you're in this pose. Okay? Fantastic. I'm ready for the next one. I'm going to take this off. This next pose is called the arched back pose, Veronica.
Okay.
You will be ultimately lying on your back again.
Okay.
This time, though, I'd like you to take a towel, unfold that for me just so it's in a rectangle like this.
Okay.
And I need you to make a towel roll, okay? So roll that up loosely. That is going to go under the small of your back. Okay?
Okay.
Good. Turn around so that you're facing that direction over there. Good. Place this towel roll right here on the lower part of your spine.
Okay.
Yes, exactly. That looks perfect. Perfect. And I think what we'll do is prepare for a headrest. Can you put this back where your head will be?
Sure.
Good. Great. Okay. Come and lie back. Keep your knees bent so that your feet are flat. There you go. And lower yourself down very slowly and carefully. As you're getting in and out of these poses, please use care. Come down gently. Good. That feel okay for your back? So with this towel roll, everyone at home, you can roll your towel roll as small or as large as you feel comfortable. The idea, can everyone see, is that Veronica's back is somewhat arched. And I'll explain why we're going to do this in a minute. Now, Veronica, fold each pillow and put one pillow on the side of each knee. Your legs are going to flop apart. Your feet will stay together. Your knees will fall out to each side. You'll be stretching your groin muscles. That looks great. That's it. For everyone at home, bring your feet as close as you can towards your body. Is that a comfortable position for you, comfortable distance? Notice that Veronica's feet, the soles of her feet are touching. Her legs are out to the side. Arms, again, can be anywhere. If you really are feeling somewhat capable and flexible, you can even bring your arms way out to the sides for this pose and get a nice chest stretch. Okay? Most of you will probably feel comfortable just having your hands something like that. Check out this pose. What do you all think, now that you know your anatomy and you know your muscles and you know your organs, what do you think this stretches? Okay, I'll tell you. It stretches the front of the pelvic floor. So for those of you who have urinary frequency, the feeling of needing to pee all the time, for those of you that think you have sort of some spasming going on around your urethra or pee hole, this is your pose. Okay? Notice that we're continuing to open the front of the body, the inner thighs. You're opening your chest as well. Belly getting stretched, and we're doing a lovely back bend. So for those of you who sit all day long, this is a wonderful pose to counteract sitting. We're really giving your back a nice stretch. This pose is also fantastic for those of you during your periods. All right? It sort of opens up the area around the uterus. Okay? So modifications to this pose would include the following. You can bring your hands to your belly for less of a stretch. You can decrease the roll under your back and make it very small. You can increase the number of pillows under each knee so that your legs aren't as widely spread. All right? And again, you could stay safely in this pose for 5 minutes, 15 minutes, even 20 minutes, using a heating pad or an ice pack. Breathing in the belly and relaxing the pelvic floor. Do you like this pose, Veronica? Okay, good. This pose really helps with urinary urgency. Okay, it's a wonderful thing to do for that. So for those of you that experience that, I highly recommend this pose for you. Okay, we're on to our last pose.
All right.
You ready?
Mm-hmm.
Okay. We are on to our very last pose, Veronica, and it is called child's pose. It's a little different from the other ones. May I please have you starting on your hands and knees?
Okay.
I'd like your knees and feet to be about a foot apart from each other. There you go, perfect. Okay. Now I'd like you to fold down, Veronica, like you're making yourself into a little ball. That's the way. And oh, take the washcloth and put it where your head is going to come all the way down to the floor. So that's just to protect your face, your cheeks. Your head will turn to one side.
Okay.
Okay, so fold all the way down, cheek to the floor. Now place your arms. Your arms can be in one of two positions. That's right. That's exactly right. They can be down to your sides and just let them relax. Or, Veronica, bring your arms in front of you and stretch them out. That's the way. Okay? This is child's pose. This is the pure form of child's pose with no supports and no props. We'll do that in a minute. But let me explain so that you can see what we're doing here. All of our other poses have been opening up the front of our bodies. In this pose, we are opening up our back body. So you can see here that we're getting a nice stretch of the back, and we're getting a stretch of the gluteal muscles, our buttocks. We're also getting a stretch more of the back part of our pelvic floors. This pose stretches the quadriceps, our thigh muscles. If your hands are up, you get a lovely stretch of the side body as well. If your hands are behind you, that can ease off some of that stretch. Okay? Let's show the modifications now, Veronica. Come on up for me. Take the green pillow and fold it in half and put it underneath your butt.
Okay.
Okay? Great. Fantastic. Okay? Come back down. Yeah, I'm going to come all the way back down. We'll do the other modification after. There you go. Some of you, all you might need to do is place a folded pillow underneath your hips. Okay? This will take some of the strain and stretch off of your trunk. Come up. Grab the other two pillows, Veronica. Okay?
Mm-hmm.
Smush them together. Fold them in half and smush them. You're going to make a bolster for yourself. And you're going to put it right in the front there between your knees. Ah, beautiful. You can leave the washcloth right there.
Okay.
Fold yourself over those pillows now, and again, turn your head, and you can just sort of hug that bolster. Yes, there you go. This is so comfortable. This is a lovely, lovely modification. Yes, and notice she's having to scooch those up a little bit because you want your head to be able to rest on that. That's exactly perfect. For those of you that might not even have enough pillows, or maybe you have kids, and one of your kids has a big stuffed animal, a big teddy bear or something like that. That's a great thing to use for this pose. Okay, so what this does now is you can see we have less of a stretch on the back, but you're still getting a little bit of opening through the back body and the back of the pelvic floor. Who should do this pose? Well, anybody, really. But for those of you who have problems with bowel movements, constipation, pain with bowel movement, this is your pose. This will open up the area around the anus, and not only that, who remembers their anatomy? Our colon is right in here, our gut. So the folding action of the hips here actually massages the lower part of our gut. So it's a wonderful pose to do to help stimulate a bowel movement. Okay? So lots of good reasons to do this pose, and it's very relaxing. And that's it. We're done with part 2. Now let's just show everybody, come out very slowly. So remember, as you're coming out of these poses, take your time coming out, unfold carefully, You are a star. Thank you very much,
You're very
Veronica.
welcome.
All right, did you have a favorite?
This one.
Yeah?
Yeah.
Is this one your favorite?
Yes.
Okay, very good. You all will choose a favorite pose, and that's the pose that you'll try to use every day. Ready to work?
Mm-hmm.
All right, we're not done yet. You guys have made it all the way to the end, towards the end of the video. We're on our final phase. How are you holding up? Because we're about to get into a part of the video that's a little more active. We are going to be stretching the muscles of the pelvic floor now. Stretching serves to lengthen or open up tight muscles. Because stretching is a little more vigorous, I have some rules, okay? They're not so bad, but I need you to follow them. Number 1, you've all heard of that expression, no pain, no gain? Well, forget about that. Throw that out the window. You are not allowed to have pain with any of these stretches. Many of you are new to stretching. So while these stretches are quite safe for most people and can be held for as long as a minute, most of you will start off holding each stretch for just 10 seconds. Okay? So for those of you who have not done much stretching before, start with a 10-second hold. Also, be sure that you're not overstretching. If you begin to feel a pinch somewhere in the body, say your hip, back off a little bit. We'll do a demonstration so you'll understand. Rule number 2, never bounce during your stretch. You've all seen in the movies, you know, someone's stretching and they're bouncing away. Well, that's troublesome. Don't do that, okay? Hold your stretch nice and steady. Number 3, breathe. Always breathe during your stretch. Don't hold your breath. Number 4, this is all about the pelvic floor, right? It's all about relaxing. So please keep your pelvic floor muscles relaxed. If you breathe normally during your stretch, you should be able to keep those pelvic floor muscles nice and loose. Number 5, a small number of you watching this might have a very special diagnosis, and it's called pudendal nerve pain. There's a big nerve in our pelvis, okay, and it's called the pudendal nerve. Some stretching can be very helpful for this condition, but some of these stretches could irritate the nerve. What will happen is, if you are stretching and you suddenly feel an increase in pain immediately, your pain, that is, just stop. Go back and let your doctor or nurse practitioner know, okay? And you guys can determine if it's safe to do the stretch or not. All right? Now, let's just do a quick little demonstration of the proper way to stretch. Super easy. Everyone, raise your right arm so that it's at the height of your shoulder. With your other hand, pull your elbow across your body. We are going to be stretching this area of your shoulder, the back of your shoulder. Pull the elbow across until you begin to feel some tension and some stretch. Okay? Now, I'm going to do something wrong. Watch carefully. You guys can just watch this part. I'm going to keep pulling and pulling. Oh, and pulling. Okay. I have reached the point of pain. Ow! It hurts here, it pinches. Ow! It's hurting right here. So what am I going to do? I'm going to back off. Oh, that's better. Okay? So all I feel now is a nice gentle stretch in the back of my arm. No pinch, no pain. Notice, I am holding it steady. I'm not bouncing. Okay? I'm holding it steady. I'm talking and breathing. And you guys can't see this, but my pelvic floor, it's relaxed, okay? So now I come out of the stretch very gently. Never come quickly out of a stretch. Okay? Now, if you put your arm down, my right arm literally feels looser and more relaxed than my left. And that's what you should feel. Okay? So let's go find Veronica now. Teach her how to stretch. Veronica, I'm excited. We get to finally start the stretching.
Okay.
All right. So for this first stretch, can you lie down, please, and put your head on your towel roll? This stretch, my dear, is called the labor stretch, the birthing stretch. You had 2 babies,
Right.
yeah?
Mm-hmm.
So you probably know this stretch.
Mm-hmm.
Please grab each knee with one hand, okay? One at a time. Keep them together as you pull them up towards your chest. Go to the point where you feel comfortable. I don't want you to feel any pinch inside your hip.
Okay.
Now, allow your legs, pull your legs apart using your hands. And do you remember all the rules? Do we bounce?
No.
No. Do we
bouncing.
breathe?
Yes.
Yes. Pelvic floor muscles, are they grippy or are they relaxed?
Relaxed.
Very good. So what this is stretching, everyone, you can see, are our inner thighs, but really we are getting the purest stretch of the muscles of the pelvic floor. So anybody who has tightness in and around the area of the pelvic floor would benefit from this stretch. If you have pain with vaginal penetration, if you have burning or urgency of urination, peeing, constipation, everything goes for this stretch. This is just a good overall stretch for anyone with pelvic floor problems. Okay? And again, just to repeat, we're going to continue to belly breathe. We're going to relax the muscles of the pelvic floor. How are you doing? Okay? You'll start off by holding for about 10 seconds or so. If anybody in going into this stretch has an increase of their symptoms, so if you have an increase of your symptoms, please come right out of the stretch, okay? And pause and we'll just go on to the next one. So that's the labor stretch, my dear. You ready for stretch number 2?
Mm-hmm.
Fantastic. How does she keep doing this? Rhonda, you keep showing up at funny moments. How did she get here? Okay, go ahead and put your legs down.
Okay.
Rhonda, what is it this time? What do you think? What are we going to teach them? You think they're ready for that? She does. I think it's a great idea. This next gem is an exercise. It's actually a technique that you can use to literally relax the muscles of the pelvic floor. It's a good time, and a good time to use this is either just before intercourse or if you're in the midst of a painful flare, if you're feeling that your muscles are spasming and tight. What we're going to do is we're going to brace your tailbone with a washcloth,
Okay.
and you are going to push. Does everyone remember where all their bones are? Tailbone in the back, pubic bone is in the front. You're going to push down on your pubic bone. And this is what happens. The muscles of the pelvic floor will slacken a little bit. They'll just gently relax. And you'll hold that for a period of time. Take your washcloth,
Okay.
and you might be able to see on the camera, for those of you at home, Veronica still has her pink dots on her, so you remember that her tailbone is in the back. Place the washcloth under the tailbone. And Veronica, spread your feet open a little bit so that everyone can see where your hands will be.
Okay.
Place the heels of your hands over your pubic bone, over that nice pink dot in the front. You are going to push down towards the floor and forward towards your feet a little bit. Super. Allow the muscles of the pelvic floor to stay relaxed and soft. Good. This stretch or this exercise is to be held for a full 90 seconds, 1.5 minutes. It takes about that long for the muscles to really let go. Again, to repeat, this is called the pubic push because we're pushing on the pubic bone. It shortens or slackens the muscles and is great to do right before intercourse, or if you're feeling like you're having a spasm or a flare. Maybe you've done too much housework or gardening or picked something up that was too heavy. Okay, so this is a beautiful technique to use. I love, this is one of my favorite gems. All right, relax. We're on to stretch number 2 now.
All right.
Okay. Second stretch, really simple. You'll be in the same exact position. Just a quick note. I have tried, and for those of you at home, I've really tried to create a sequence of stretches that's really easy to do. Not much moving around, not much changing of position. So most of these stretches are done right on your back, okay? So just letting you know. I really was thinking about your time and to not have to use up too much of your time. Stretch number 2.
Okay.
Bring your left knee up towards your chest, just like you did before, except just the one leg, and hold on with both hands. Lower this other leg so it's flat. This is called knee to chest. Okay? That's all. Because you're trying to bring your knee towards your chest. Now, a modification of this pose, and typically, what I experience with my patients at my office is the first thing that might happen is that you're going to get a pinch inside your hip. If that's the case, do you remember what you do? Just back off a little. Good. And see if that works. We should be stretching the area of our buttock, right in there. Great. You feel a stretch? Fantastic. If you can feel the stretch, but you still feel a pinch, try this next little maneuver. Bend your other leg up and just put the foot flat.
Okay.
There. Okay? That should ease things quite a bit, and you may even find that you're able to pull that leg a little bit more. Okay? Again, to reiterate, to repeat, you will hold for at least 10 seconds. If some of you feel safe enough to hold longer, please do. You can hold these stretches for as long as a full minute. A full minute, okay? So I have a little clock handy. Are we bouncing?
No.
No. Are we breathing?
Yes.
Yes. Are we relaxing the pelvic floor?
Yes.
Fantastic. You would then switch legs, okay? And just real quick, you can do the next leg. Fantastic. Then after you've done the second leg, you'll do both legs together.
Okay.
Can you bring the other leg up?
Mm-hmm.
Hug them to your chest. Lovely. Okay?
Mm-hmm.
Knees to chest. We're on to the next stretch now. Veronica, this is a stretch that I call the figure 4 stretch. You're going to be making the number 4 with your legs, sort of an upside down 4.
Okay.
I would like you, oh, and for you smarty pants at home who've noticed that we have a white sheet over Veronica's stomach, it is for filming purposes, okay? I know that probably all of you noticed that. Would you please cross your left ankle over your right knee? Very good. With your hands, both hands, can you wrap each hand around the right thigh, and you will bring your both legs up towards your chest. Okay, but you're going to hold behind your right thigh. Yeah, you can use your leg muscle to help get it up there. Fantastic. Very good. So you're holding around your thigh, and you're pulling both legs up towards your chest, and you should feel the stretch in the area of your left hip. This is a stretch to open up the hips. our hip muscles actually make up part of the pelvic floor. So many of my patients have very tight hips. This stretch is marvelous if you've been sitting all day long. This stretch is fantastic for people who have any kind of tightness in the pelvic floor. You really can't go wrong with this stretch. For those of you who have ever experienced pain down the backs of your legs, sciatica we call that, this stretch actually stretches the area of the sciatic nerve. Okay? Come down, Veronica, carefully, and let's show a couple of modifications.
Okay.
For some of you who are very tight, it may be that this is all you do. No pulling, no lifting. You'll just cross your ankle over the opposite knee. All right? Some of you may be able to bring your legs up a little bit, but you can't quite reach with your hands. So I'm going to give you this belt.
Okay.
You can use any belt. And I'd like you to wrap the belt around your right thigh. That's the way. That's the way, good. Okay? And again, for filming, just so everyone at home, I'm going to lift her leg a little bit so that you can see what we're doing. But for those of you at home using a belt, scooch that belt way up high. Okay, it'll be better leverage. Okay, but just for the sake of viewing, you can see that she's wrapped her belt around her thigh and now she's using the belt to help pull. Okay? Come down gently. Of course, you would then switch legs and do the other side. Okay, but we're going to go on. This is a stretch for the inner thigh muscles. I call this the frog position, okay? What I'd like you to do is you'll start with your knees bent just like this and bring the soles of your feet together just like you did for that other resting pose, the arched back pose. That's the way. And you'll allow your legs, you're exactly right. Your legs, your knees will flop out to the sides and you can see that we're getting a nice stretch of the inner thigh. Again, this is a wonderful stretch for the front of the pelvic floor. For those of you who have urgency of urination, frequency of urination, or pain with intercourse, fantastic stretch for you. It's very similar to the resting pose that we did earlier, the arched back pose. You'll notice, though, there's no bolster or towel under her back. All right? Let's show them the modification with the pillows, huh?
Okay.
Carefully. Now, for everybody, very carefully come out of this pose. Be really gentle coming up. If you stay in that pose for a minute, those little thigh muscles, they can get really stretched out. So you want to ensure that you come out of this pose gently. Just like before, you'll modify the pose by placing a pillow under each knee. Again, this pose, this stretch is safe to do for 10 seconds all the way up to a full minute. Breathing and relaxing. Beautiful. All right. On to our next stretch. This next stretch is called the trunk twist. So let's have you bend your left leg so that the foot is flat. Move your right leg inward just an inch. Everyone at home, follow along. Bring your left knee now across your body, and you can use your hand to help. You can even allow your foot to rest on the other thigh, on your opposite leg's thigh. Good. Your left arm will swing up a little bit to your comfort level. Very nice. And what we're doing here now is we are getting a lovely stretch again of the hip, and we're getting a beautiful twisting of the low back. Are you okay in that pose while I talk? Mm-hmm. So For all of you who do a lot of sitting or bending, this is a wonderful pose to release the spine. We really notice that when our pelvic floor muscles are tight, oftentimes our backs are tight too. So if you can do a little stretch to release the low spine, it really, really helps the pelvic floor muscles release. Notice that Veronica is using wonderful form. She's breathing, and I can see her belly rise and fall. And I just bet that she's even keeping her pelvic floor muscles relaxed for this. Again, you'd hold for about 10 seconds if you're new to stretching. Okay? And again, as far as pelvic floor disorders go, anybody could benefit from this. This is a good overall stretch. After the 10 seconds or longer is up, you'd switch sides. Okay? But let's go on to our next stretch to show you the hamstring stretch. We're on to our hamstring stretch now. Do you know where your hamstring is? Mm-hmm. It's the muscle behind your thigh, right? Mm-hmm. Okay. So let's use your left leg and have you bend your left knee so that your foot is flat. And then just continue to pull the leg up. Use your hands and come behind your thigh, behind your knee. No, you were right the first time. Okay. So you'll interlace your fingers. Good job. This, everybody, is our hamstring muscle. It's actually 3 muscles. So the hamstring muscle attaches, hang on 2 seconds. The hamstring muscle attaches onto the sitting bone, okay? So it attaches on each side onto our sitting bones. What's the sitting bone? It's one of the 4 bony corners of our pelvic floor. So this is a fantastic muscle to stretch when you have a tight pelvic floor. So from this position now, Veronica, can you just lift your leg? You are not going to get your leg all the way straight unless you are a dancer or a professional athlete, okay? This is, there are many, many ways to stretch our muscles. Again, I have really carefully thought about this and I've tried to pick the easiest stretches that I could give you all. So, holding onto the thigh, lifting the lower leg, stop when you feel a nice stretch of the hamstring muscle, okay? And again, you would hold that for about 10 seconds, longer if you can tolerate it. Then slowly lower the leg and bring it back down. I'm going to show you one more way to do it. Let's use the belt around the foot. Okay. You will place this belt, Veronica, around the ball of your foot. Okay? So for those of you at home, you can do this with a belt or a sheet. Either is fine. Now, carefully hold on to the end of that belt. That's a little short for you. You have long legs. And I need you to actually straighten that. Yeah, you're going to straighten that leg. Okay? Careful. There you go. Now, carefully lift the leg up. And yes, beautiful. You can tighten that knee a little bit. Good. Now, so everyone has their strap around the left foot. They're carefully lifting the leg in the straight position up into the air until you feel that same stretch in the hamstring muscle. Lovely. Beautiful way to stretch your hamstring. Again, 10-second hold, unless you feel comfortable holding for longer. Okay, now to come out of this, Veronica, can you bend your knee? Yeah. And start using your leg muscles to hold your leg. Okay, there you go. And come out slowly. And then you'd repeat on the other side. Beautiful job, thank you.
Thank you.
All right. I think we're on to the stretches now to be done in the standing position.
Okay.
All right. Veronica, what we're going to do next is a stretch for the front of our hips.
Okay.
I call this the hip flexor stretch. The hip flexors bend our leg up. Okay? So we're going to stretch that area. Everyone at home, notice how I have positioned Veronica. You will need something nearby to hold on to for balance. And I would position yourself just behind it. Or make sure that whatever it is you're holding on to is long enough for you to adjust your balancing hand. So let's have you take a giant step forward with your right leg.
Okay.
Keep your toes pointing straight ahead. Beautiful. I'm going to show everyone, Veronica, how to do this incorrectly, and I'm going to ask you to point your toes to the side. Okay? That's incorrect because it changes the whole alignment of your leg. Now, point your toes forward. Good. Both feet have their toes pointing forward. Wonderful. You're holding on for balance. You are going to carefully bring your body weight forward onto the right leg. The left leg will begin to stretch in the front of your body. The heel of your left foot will lift off the floor. Can you point with your hand where you're feeling the stretch, Veronica?
Right here.
Beautiful. That's exactly where you should be feeling it. Okay? Now, we so often are showing modifications, making things easier. Let's show a harder modification.
Okay.
All right. Can you shoot your left arm way up high in the air? Ah, lovely. Now you're getting a nice big stretch all through the front left side of your body. Take a nice breath in and enjoy that. And relax. Let's come out slowly. Lower your hand. Okay? Shift your weight back onto the left foot. Good. And go ahead and step back. Lovely. Good job. So who would do this stretch? Well, let me tell you something. My patients who have urgency of urination and go to the bathroom frequently to urinate love this stretch. This stretch actually can oftentimes rescue a person from experiencing their profound sense of urgency. So, for those of you that have that as a particular symptom, I highly recommend doing this stretch. Remember, start off for 10 seconds, try to increase the duration, hold it nice and steady. All right? Let me just add one more thing. Come back into that stretch. If you're feeling too much of a stretch, let's take this step back about 3 or 4 inches. There you go. You can modify this position by shortening up the stride length. All right? So that's a nice way to modify it. And then come on out.
Okay.
Okay, and of course you'd switch sides and do the other side. All right. We have one stretch left, and it's one of my favorites.
Okay.
All right. We've made it to the end of our stretching routine. We have one stretch left, and I am going to do this stretch with Veronica today because I feel like I need a good stretch. You guys have been fantastic. I call this the side body stretch. It will stretch the sides of our bodies. Okay? You can also call this the tree swaying in the breeze stretch. What's your favorite tree?
A palm tree.
A palm tree. Oh, I'm thinking vacation and okay. I think mine is the apple tree.
Okay.
Yeah. So, to start with this stretch, have your feet so that they're about hip width apart. All right? Don't keep them too close together. I want you all to have good balance. Straighten up in your body, Veronica, so that imagine everyone at home, imagine that you are increasing the distance between your backbone, all the little bones in your back. Okay? Slowly bring your arms up over your head, and you're going to hook your thumbs, Veronica, like that.
Okay.
Can everyone see that? You're going to hook your thumb. Now, let's do one more big lift. Raise your arms up towards the ceiling. Deep breath and exhale. Good. Let's sway to the left first, Veronica, all right?
Okay.
We are going to stretch the right sides of our body. And that's about where I feel the end of my stretch. And carefully come back to the center. Off to the right now.
Okay.
And now we'll stretch the left sides of our body. You can hold this for 5 or 10 seconds and take nice breaths into your side body. Whew, and coming back to the center. And then relax those hands. You did it. Thank you again for being our wonderful patient.
You're
You are
welcome.
absolutely spectacular. And thank you all at home for participating with us. You have completed the stretching segment. Congratulations, everyone. You've all made it. You have successfully completed watching and participating in this DVD for managing your pelvic pain. We have shown you a lot. You all have become experts in the anatomy of your pelvic floor, and I hope that you have an understanding of the relationship between the organs and bones and the muscles of your pelvic floor and how it affects your symptoms. You've learned a simple exercise to relax and drop the muscles of your pelvic floor. You have learned 4 poses, positions to rest in each day to practice your relaxation techniques. You've also learned a handful of stretches to further open and lengthen tight muscles in your pelvic floors. You've also met my buddy, Rhonda. Rhonda taught you 3 gems. Do you remember what they were? The first gem involved finding good, balanced sitting posture. The second gem was about breathing in your belly. And the third gem, my favorite, was the pubic push. That's the way that you can relax the muscles in a moment's notice to decrease pain in that very moment, using nothing but a washcloth. She's pretty smart, that Rhonda. Here's where your diligence needs to kick in. You need to do these exercises and relaxation techniques daily. Please consider these teachings your medicine. Just like you would take a pill every day to cure a sickness, you are going to do these stretches and relaxation techniques daily so that you can heal yourself. I see my patients heal and get better all the time from this. I wish you all the best in your healing journey. Thank you so much for being with us today. Don't give up, and I wish you the best of luck.